An ideal scanning room will be divided to two areas. Involved personnel are expected to operate Iris XP in the area A, and patients are assigned to the area B for scanning. In this way, a patient privacy can be secured. We suggest the temperature in the room should be 21 to 25 degrees, and humidity should be 30 to 75%. In case of breast screening, the temperature is required to be 18 degrees. The room should be insulated from the direct sunlight and floor heating systems should be prohibited. If the room comes with windows, please close the curtains. Patients must have time for their body to recover to their own temperature. They are required to take a rest for about 5 to 10 minutes before scanning. The camera also needs to be warmed up for about 10 minutes to detect the accurate temperature. Once the Iris XP program is executed, please wait for 10 minutes before scanning. Push the green button to boot the system. Then Iris XP program will be automatically executed. This is the main screen you will see at first. On the left side, thermal images will be displayed. On the right side of the screen, the control panel where you can operate the system is located. To scan patients, the patient information must be registered in the system. In the upper right corner of the screen, locate the Insert button and click it. Then the Insert patient information will pop up. In this section, chart number, name, gender, and birth date must be filled out for the next step. Once you are done, click Scan. Then automatically the screen will change to scanning screen. Once the scanning screen turns on, the lens protection gear covering the camera lens will slide open. Make sure the target part must be in the center and be full in the screen. There are 4 arrows in each direction. Using them, adjust the camera angle. Then using the foot switch, adjust the height of the stand. When you're ready to take images, first of all, click the auto button. This button will have the camera focus on the target. This button is not applied to the manually adjusted camera. In this case, adjust the focus dial attached to the front of the camera to get the clear target. Then click the Auto WL button. This button will have the camera detect the accurate temperature and correct the colors seen in the screen. Lastly, click Save and the images will be saved. If you click Color, you can choose different color modes. You will be provided with 19 color modes. Choose the one you want to use. The lower the temperature is, the darker the color is. Therefore, when the temperature is too low, it is likely to be invisible. In this case, click the WLBG button, and you'll be able to see the boundary of the invisible part. Iris XP scanning instructions consist of cervical series, lumbar series, shoulder, knee, face, hand, and breast. Those example images are on the left side of the scanning screen. Please refer to them. You'll be provided with a foot mat and a spongy board. You're required to use them to obtain precise images. Place the foot mat 1 to 1.5 meters away from the equipment, and patients are invited to stand on it. The distance between the mat and the equipment can be adjusted depending on situations. The footprints on the mat help patients to pose for scanning, but they don't have to be used at every scanning. The scanning poses are based on anatomical position, and the target part must be fully exposed without any clothes. From now on, the instructions on cervical poses and lumbar poses will begin. Please refer to the other poses specified on the left side of the scanning screen. Cervical series consists of 6 poses: anterior pose, posterior pose, lateral poses, dorsal hands, and ventral hands. For the anterior pose, place both feet on number 1 of the foot mat with both palms facing the camera. In this case, all fingers are not supposed to be touching. For the posterior pose, turn around and stand with your back toward the camera. All your fingers are not supposed to be touching. For the lateral pose, stand with right hand toward the camera for scanning right hand, and stand with left hand toward the camera for scanning left hand. In this case, whole arms and lateral side must be in the screen. For the dorsal hands, place the spongy board on a chair and lay both hands on the board. Dorsal sides must be toward the camera with all fingers stretched so that the camera can get the clear boundary. For the ventral hands, have the ventral sides faced with the camera, and all fingers must remain stretched. Lumbar series consists of 6 poses: anterior pose, posterior pose, lateral poses, plantar pose, and back pose. For the anterior pose, place both feet on number 1 of the foot mat with both arms crossed on shoulders. Then adjust the camera angle. Make sure both legs must be fully exposed without any clothes. For the posterior pose, turn around and stand with your back toward the camera. Then adjust the camera angle. Place both hands on shoulders so that the camera can get the clear shot. For the lateral pose, place both feet on number 2 of the foot mat with both arms crossed on shoulders for scanning right leg. Then adjust the camera angle. In this case, whole lateral side must be in the screen. Place both feet on number 3 of the foot mat with both arms crossed on shoulders for scanning left leg. For the plantar pose, kneel on a chair and cover the legs except for the feet. Then adjust the camera angle to get the feet. For the back pose, patients must be fully naked with both hands over his or her head for this pose. The lumbar area and hamstring must be exposed. Once you save images by clicking Save, click Scan Exit in the bottom right corner of the screen. The images must be properly adjusted to perfect conditions for diagnosis. First of all, you are invited to use the exam mode or compare mode for this. The exam mode will display images in orders you took them in. However, in the compare mode, you can select images and arrange them in orders you want. The 5 buttons above will let you display images 1 by 1 to 4 by 4. The lower the temperature is, the darker the color is. Therefore, when the temperature is too low, it is likely to be invisible. In this case, you can adjust the color spectrum. In the color spectrum, lower temperature is indicated in black and higher temperature is indicated in red. Move the orange bar to make the invisible part visible on the screen. Click the color button and you will be able to choose one of the color modes where the temperatures are displayed with 19 different ways. If the images are well adjusted, diagnose patients by measuring the temperature difference on the patient's body. If the temperature difference between the painful area and symmetric one is higher than 0.5 degrees, usually potential issues are suspected. You are required to leave ROI marks on the painful area and the symmetric one. Then temperature difference will be automatically calculated. In the upper right corner of the screen, you'll be able to see the guide button. If you click this button, guideline for each position and clinical applications you can refer to will be indicated. Please utilize them for diagnosis. Once you choose the ROI mark you prefer, click and hold the left mouse button. Then move your mouse to draw the mark. Next, double-click to leave the same mark on the symmetric area. The ROI mark must stay in the body part. Once you leave the ROI mark, identification numbers are assigned to each mark. You can see the data information along with the number. Average temperature, standard deviation in the ROI mark, minimum temperature, maximum temperature, temperature difference, and the number of pixels will be indicated. If you want to delete the ROI data, click the identification number of the ROI you want to delete in the information board, then click the clear button. Be aware that all the data will be deleted if you click the clear all button. If you want to draw a polygon shape for the ROI, click the pentagon. Then you can make vertices by clicking the left button of your mouse. Once you make a shape you want, click the right button of your mouse. Then draw another shape on the symmetric area. This is expected to be used for breast screening. In this way, users can draw the accurate shapes for breast. If you click mirror and make a polygon shape, you will have the mirrored shape for the symmetric area. Iris XP can recognize the patient's positions and provide the reference standard for the temperature difference in the target. For example, if you choose the anterior image and click Image Analysis, Iris XP will recognize the anterior pose and provide the reference standard for the normal temperature difference in each area. If you click the red dot, normal temperature difference will be indicated. The red dots can be clinically applied for diagnosis. Refer to the red dots and draw the ROI marks along with the dermatome. Iris XP comes with AI algorithm and it can analyze the percentage of lumbar issue. Lumbar issue can be detected based on the anterior pose, posterior pose, and plantar pose. Select one of the three poses, then click Analysis and Image Analysis. Then AI command on the lumbar issue will be indicated in the Image command section. If you click Save, the AI command will be saved in the Additional command section. You can leave either automatic commands or your own commands. If you want to leave the automatic commands, first of all select the body part. Then the related disease will be automatically selected. The automatic commands will be saved in the opinion section. In this case, the ROI must be marked on the images. The automatic commands are based on the temperature difference arising from the ROI marks you left. In the additional commands and comprehensive opinion section, you can leave your comments. Leave your comments for each image in the additional command section. On the other hand, leave your comments for all the images in the comprehensive opinion section. You must click Save to save them. The AI commands will be described in the additional command section. If you want to add your comments, you can edit the additional command section. you must click Save to save them. The commands will be also printed on the report. For this, 1x1 or 1x2 frames must be selected. If 2x2, 3x3 or 4x4 frames are selected, commands will not be printed on the report. Click Print and the print preview will pop up. In this window, you can preview the report. Using the zoom button, you can also zoom in. If you click Save, the result will be saved. The location would be Local Disk C, Medicore. To load the patient's data, click File Open. Then the File Open will pop up. If you click all the data will be displayed. Now, you can search the data by chart number, name, or year of birth. Select the patient data you need and click Open. You can also load multiple data. Select the previous data before treatment and the ones after the treatment with Control key pressed. Then click Open. And select the Compare mode. Now, select the image before the treatment and the image after the treatment. This function is expected to be utilized for monitoring pre- and post-treatment. If you want to take new images of patients who are already registered, first of all, click chart number or name. Once you find the data you need, click Scan. To delete the existing data, click the File Open button. Search and select the data you want to delete and click Delete Patient. If you want to save images on desktop, click the right button of your mouse on the image you want to save. Then click Save as Image and save it. You can also click Analysis and click Save As to save images. If you want to save ROI data in Excel, click Excel. Then data will be saved on desktop. Select the patient's image and click Pain Chart. On the pain chart, the pain patients insist can be recorded. Select the body part, pain type, and drawing tool. Then mark the pain using the left button of your mouse. For the rest of buttons, please refer to the instructions here. If you want to shut down the system, click X button in the top right corner of the screen and click Yes. Then Iris XP program will be turned off. Now, click Window and shut down the system.